Hi, my name is Kate White, and I am the Director of Training for the Postdoctoral Residency Program at Psychology Specialists of Maine. And I'm making this video to give you some information about our program so that you have some of the background that you might need, just to learn more about what we're doing, make your choices as you're going ahead with your postdoctoral residency training year, and to give you some information before you come in for your interview. So my hope is that you have some information now, and then you can ask additional questions when you meet with us. So what I'll be doing in this presentation is going over the goals and objectives of our program. I will also talk about some of the clinical and didactic training experiences that we offer over the course of the residency year. I'll talk about the training tracks and content of each of those training tracks. And then I'll also talk a little bit about just overall structure of the program and how you would be spending your time here. So I will begin with talking about the program aims and training objectives. And really, first and foremost, our goal for the year is to train competent, skilled generalists who will be fully prepared to succeed in independent practice. So by generalist, I mean somebody who can really pretty comfortably work with a wide range of presenting problems and offer a number of different modalities in terms of treatment options as people are coming in for therapy. So I expect that graduates of our program would be really amply prepared for a number of different career paths after graduating from our residency program. So many of our residents go on to work in private or group practice, but really any outpatient clinical setting would be a good fit for somebody who does our program, including things like university counseling centers. And really, again, the goal is for people to feel really confident and ready to go into independent practice after they complete our program. Our second goal is to encourage the development of your therapist identity as it intersects with and builds upon your other identities. So for postdoctoral residency, you've already had a lot of training over the course of your obtaining your degree, and here you are in your final year of training. And I think a major focus of our program is to really help you to kind of build a sense of who you are as a therapist. And that might be things like the kinds of therapy that you really enjoy doing, or the kinds of clients or other work that you really enjoy. And also just, again, sort of how you are as a therapist, who you are, how you are, and how that may intersect with or overlap with your overall identity. And then finally, a major point of our program, of course, is to develop confidence in diagnostic assessment and intervention using multiple evidence-based treatment modalities and approaches. And I'll talk a little bit about, in a few minutes, kind of the specialty areas that we offer in terms of forms of therapy or client populations. But really, through the course of this training year, we're hoping to kind of refine your skills in terms of diagnostic assessment, maybe things like kind of picking assessment measures, or doing what you need to be really confident in the diagnostic sort of assessment of a client. And then, really getting comfortable with developing a treatment plan and executing it. So picking therapy approach or integrating in other treatments, and really doing what you can to put together a comprehensive plan to really support the well-being of your clients. We have a number of different clinical and didactic training experiences that we bring in throughout the year. And so I'd like to go over those now. In terms of clinical experiences, we have a core set of training experiences that all residents will participate in. The biggest one probably being provision of individual therapy. So every resident has a caseload of individual clients. And I'll talk in a moment about some of the specialty areas that you might dive into over the course of your year here. But yes, importantly, in order to really kind of become confident in that generalist approach, we encourage you to take on really a range of therapy cases. We also provide track-specific clinical supervision. So depending on the training track that you choose, you will have extra supervision in ADHD, DBT, and or EFT. And then finally, as many clinics have, and since the start of COVID, we have really embraced teletherapy. And I think interestingly, especially in a state like Maine, which does have a large rural population, we are finding that teletherapy is making therapy much more accessible to clients who maybe would not be able to access this service otherwise. So we continue to offer teletherapy, and we provide some supervision to postdocs as well in terms of how to best use that method for providing therapy. In terms of individual therapy specialization, so of course there are the training tracks, which I'll talk more about in a moment. But in your individual caseload, for your sort of general therapy clients, you will be able to choose a supervisor to work with, either for the full year or for a 6-month rotation and then switch. And we have really a range of specialty areas amongst our staff. And so we encourage you to choose a supervisor based on really what you're hoping to kind of learn more about and really kind of hone those skills in this last year. So we have a number of staff who are really skilled in providing empirically supported treatments for trauma. In particular, we provide the 2 gold standard approaches for treating PTSD. So those are cognitive processing therapy and prolonged exposure. We also have a number of staff who provide psychodynamic, emotionally focused, and interpersonal approaches for therapy. Additionally, staff who do cognitive behavioral therapy, dialectical behavior therapy, and acceptance commitment therapy. And then finally, staff who really specialize in mindfulness or other mind-body interventions, things like biofeedback. And so with a wide range of specialties out there, if there are additional things that you're wanting to really develop some expertise in, then we can offer that through your individual supervision. All of our supervising staff also identify as generalists. And so they would be really well prepared to supervise on any kind of case that you might see. In addition to these clinical experiences, of course, we have a lot of didactic training experiences that we offer as well through the year. So first off, just many kind of things that we offer to our residents and also our staff generally to just continuously be working on our clinical skills. So our site at Psychology Specialists of Maine, we lead a number of clinical training seminars throughout the year, usually roughly quarterly, to the larger group of mental health practitioners in Maine for continuing education credits. So we offer half-day and day-long clinical training seminars that are kind of a great way to get a deep dive into some clinical topic, and our residents also attend those. Furthermore, we have our track-specific training. So depending on which training track you're involved with, we have a mix of some self-study, maybe some readings or manuals or kind of background information to be taking in, videos to watch, things like that. We also have meetings, kind of seminar style training meetings, talking through the details of the model that you're learning or the clinical service that you're providing. And other sometimes more experiential learning offerings, things like shadowing or co-leading, which I'll talk a little more about when I talk about different tracks. We also have monthly meetings as a full PSM staff to do consultation groups. Actually, we have 2 monthly meetings for that, as well as opportunities for the residents to meet monthly to do a peer consultation group. So lots of opportunity to be talking about cases and learning from your colleagues here about how they do therapy, what they recommend, things like that. We also have some professional development series that we run throughout the year. So some, like our Lunch and Learn training series, are for the full PSM staff. So each month we bring in a specialist in some topic to talk to us about, really a range of things, sometimes, ethical or legal topics, or clinical topics like how to work with certain kinds of diagnoses or certain kinds of training or therapy interventions, really a range of topics there to just be continuously honing our skills. And also we have a professional development seminar series that is really directed at our residents. And so the residents attend that monthly. Again, on quite a range of topics. We recognize by the time you've come to us that you've had a lot of training over your years. And so we really try to aim those topics at what are those kind of last bits of things as you're this far along in your training. What are those kind of final topics that you might be wanting to either learn more about or apply as you're going into independent practice. We'll talk a little bit more now about our specialty training tracks. So we have 3 training tracks that we offer. And I want to say just first off that although we present them as sort of, you have to choose a primary track amongst these 3, and that is true, we also do really encourage you to take advantage of any of the training experiences that we have here at PSM. So if that means you want to, maybe specialize in one particular training track, but also maybe add on a second one or gain some experiences in a secondary area, we absolutely encourage and can support that as well. So you aren't kind of focused entirely on one thing through the training year. We estimate that maybe roughly 20–25% of your week will be spent in your training track area, either having clinical experiences in that area or didactic and training experiences. So that leaves plenty of time to also bring in some other areas of expertise. That said, we have these 3 training tracks that we are offering. So attention deficit hyperactivity disorder. So we do have our ADHD track. The goal of that track is really to gain expertise in both assessment and treatment of ADHD. So through the course of the year, residents in this track will be conducting many kind of psychological assessments to determine whether clients have ADHD or make a differential diagnosis. So that includes both doing a psychodiagnostic interview, some targeted assessments and testing, and writing up those reports for the client or anybody else who's requesting them. And then presenting that feedback to the client, often with some treatment recommendations. Residents in this track will also be providing ADHD treatment, and that includes with individual clients as well as in our group that is oriented towards people with ADHD learning skills in that group format. And that is a group that you would be co-leading with another PSM staff. Then we have our dialectical behavior therapy track. So for that one, we will be really teaching our residents about the theory and practice of the full model of DBT. So that includes co-leading a weekly skills training group. And that really follows the sort of traditional DBT approach of working through all 4 of the modules over a roughly 9-month period with group members kind of coming in and out over that time. Residents will also practice individual therapy with DBT-oriented cases and participate in a DBT consultation group. So that is meeting with other therapists at our practice who also run DBT groups and practice DBT in their individual cases and providing support and consultation to each other in that group. And then finally, we also have a number of training experiences, including some self-study and participating in some seminars and targeted supervision to further support learning that DBT model. By the end of the training year at PSM, we would expect that residents would have just about everything they would need to, if they wanted, apply for certification in DBT. And then finally, we have our emotionally focused therapy for couples track. So in this track, kind of similarly to DBT, there is the goal of really developing competence in the provision of couples therapy, in this case, using the EFT model. So that includes working with a range of couples in therapy over the training year with a lot of really supportive supervision around how to implement this model. Residents would also co-facilitate EFT workshops that would be kind of short-term interventions for couples based again in this EFT model. And then finally, some self-study and meetings, training meetings to again really learn the sort of intricacies of the EFT model and how to implement it in therapy, as well as with supervision in that area. So with all of our training tracks, they would include, in addition to kind of didactic training experiences, 1 hour per week also of targeted supervision in that track. So ADHD supervision, DBT, EFT supervision, depending on the track. Finally, a little bit of information about just really what your week would look like if you were a resident here with us at PSM. So we do work 40 hours per week, regular business hours, Monday through Friday. And we do really encourage and kind of implement in our schedules for our residents time throughout the week to both be seeing clients, but also doing non-clinical work. Every resident gets an office and also access to communal workspaces with teletherapy resources, so ways to kind of set your office up to be able to provide teletherapy effectively. And I really encourage you to take a look at the information that I send about kind of our office space. We're in a really lovely environment here in an old mill in Brunswick, Maine. We have our residents scheduling about 22-ish individual and couple sessions per week. All of our residents also co-lead some sort of a group. And so again, to be skilled in lots of different forms of therapy, group therapy is one thing that we really encourage our residents to engage with. So some of this might be dependent on what track you're doing, but we offer ADHD skills groups, DBT skills groups, and interpersonal process groups. Additionally, each resident spends time in their weekly supervision, so 1 hour per week with their more kind of general individual therapy supervisor, and then 1 hour per week with their track-specific supervisor. Weekly didactic trainings take up several hours each week as well. And then consultations up to 1 hour per week with either all PSM staff or with peers, and then extra time built into your schedule for things like documentation, and any areas of self-study that you're completing for your track or for just general kind of professional development. And so that is my overview for you of our postdoctoral residency program here at Psychology Specialists of Maine. I hope that this gives you some just baseline information about what to expect from our program, but please do bring any additional questions to your interviews. And we really look forward to talking with you more about what we offer here and hearing about your goals for your residency year and seeing how we might be able to really help you along in your final year of training here. So I really look forward to meeting with you, and thank you so much for taking a look at our video here. Bye-bye.